Hey there. I live on a non-working farm surrounded by acres of cows and corn that's about 5 miles from town. And I bike by these fields all summer long on my way to work. And I think about the similarities between our small farmers and our independent doctors. They're hardworking, determined, reliable, and strong. They're passionate stewards of our community. They work incredible hours, and they have a tremendous sense of pride in the work that they do. And while they're the backbone of our community, they're disappearing at a rapid rate. And just as you might think of farmers as the foundation for the food system, primary care is the foundation for transforming our healthcare system. For almost a century, small farmers have had the ongoing support of local extension agents who come out to their farms to help coach and advise them on ways to update their operations. But independent physicians all these years have had to defend for themselves. And in this room, we all know that the Affordable Care Act has placed a premium on primary care and a real sense of urgency to develop a strong foundation based on the patient-centered medical home concept. We knew that in our rural area, our physicians needed to upgrade their operations, and it needed to happen quickly. So we took a page from our farmer friends and developed a plan to help renovate their practices into patient-centered medical homes. And in Western New York, we're using a model of the primary care extension service. And it's in order to help the practices rebuild their clinical operations. In our area, our health extension agents are called Practice Enhancement Associates, or Ps. They are local folks trained by the university who work part-time in each practice on their sites. And you might think of a P as a do-it-yourself designer or builder who brings in ideas and strategies to help the offices figure out how to make best practice principles work for them. We have a variety of Ps. They are all homegrown and trained in basic facilitation skills. In addition, our Ps have, the Ps in our pod, I should say, have cultivated expertise in certain areas that's all their own. It might be super use of an electronic medical record, data analyst, consumer engagement, compliance plans and policies, or care management. Our objective in all of this was to plant a P in each practice 1 day a week and hope that they would grow to be part of the practice team. And I have to tell you, this was not an easy row to hoe. They were, practices were not really buying what we were selling in the beginning. But eventually, one by one, some of them agreed to try it. So we took a P and we planted it in the office 1 day a week and hoped that nobody would step on them. And they just kind of hung around, and they spread a little fertilizer, like bringing in a tray of homemade brownies, or doing the dishes, or even jump-starting a frozen battery. Do anything. Gradually, the staff warmed up, and we knew that germination had begun when the practices started to let the Ps do things like data entry, answer the phone, or maybe they even asked for advice. So they established a trusting relationship with the practices that really allowed for transformation and growth to begin. And from there, it didn't take long for the plan to flower. The practices really started to enjoy having those Ps in the office. They loved the extra hands in the office. And they would actually call our office and ask for extra time with their P, so we knew we were making headway. And as needs arose and things changed for the practices, the Ps would bring in other expert Ps to assist them. And this allowed for best practices and great ideas and strategies to be cross-pollinated among the practices. And I have to say that the yield has been good. We now have a hearty crop of newly